Hi, I am Pilar de la Puente, Assistant Scientist at Stanford Research and an awardee of the DaCCoTA Ready to Go Pilot Award. This project is focused in the engineering of a physiologically relevant ex vivo 3D ovarian cancer culture model for precision-based drug screenings. Ovarian carcinoma is diagnosed very late in the disease due to non-specific symptoms, often called the silent killer. 80% of patients develop vivo resistance within 5 years. Both in vitro and in vivo systems have shown that various interactions affect tumor progression and therapy resistance. However, high cost and specific dependent difference make it challenging to isolate the mechanistic links. Tumoroids or tumor-like organoids have been shown to retain both histological and genetic features of original tumors and are feasible for in vitro drug-sensitive assays, recapitulating clinical response of the matched patients, but often they lack physiologically relevant physical characteristics. The overall objective of this investigation is to provide a translationally relevant 100% patient-derived ex vivo 3D culture platform with controlled physiologically relevant physical parameters to perform clinically relevant analysis of ovarian carcinoma treatment response. The methodology consists of isolating from plasma blood samples and tumors, which they will be grown in a plasma-derived fibrinogen cross-linked to fibrin plasma clot that allows tumoroids to be grown. This system is called the patient-derived tumoroid model, or PDT. This model has been used for drug screenings, and we have done a lot of different assays as apoptosis assays for testing viability and cytotoxicity. These different readouts will be used for creating a predictive score that will be compared with clinical results and establish the predictability of our system. In figure 1, you can see how PDTs support better growth of the primary tumors better than other traditional models like 2D and 3D. This is how the culture looks like, the matrix on the media on top, how the tumors grow inside of our system, and how a system is able to recapitulate key characteristics of parental tumors. This is an epithelial tumor, so cytokeratin stains in red for epithelial structures, and PAC6 is a very characteristic marker of ovarian carcinoma. As you can see in our PDT systems, we recapitulate the same structures. We also are able to recapitulate epithelial versus stromal structures, epithelial in red, stromal in green. As you can see, parental and PDTs have preservation of both. Also, our system is able to recapitulate the biochemical signals and preserve the same signals from parental tumors to PDT. No changes were identified. Our system or platform can be used for histopathological screenings like scores for proliferation like K67, apoptosis CAPS-P3, and CD4-CD8 ratios. And we can establish clinically relevant tumor microarrays in which we can compare parental and PDTs. Once this model was characterized, we have focused on studying drug sensitivity studies in a retrospective study in which we were able to identify patients which known by RECIST score resistant versus sensitive status. You have in here the table with the characteristics, and they were treated with the standard of care carboplatin Taxol. We studied the same, and we were able to show that we can predict the same therapy response, either resistant versus sensitive, that it happens in the clinic, that it was established over a course of a year. We were able to establish those screenings in only 7 days. So right now we have confirmed that our model recapitulates key characteristics, so it's a well-suited platform to study chemotherapy response of ovarian carcinoma patients in a biologically relevant manner. This study is a retrospective study. Now we want to establish the scores that really define and differentiate and distinguish resistant versus sensitive patients, and therefore these scores will be used in prospective studies. Our results present a reproducible and clinical translatable preclinical model assessing efficacy treatment options by predicting therapeutic efficacy and according treatment with drugs that the tumor will be resistant. Moreover, our results are expected to have an important positive impact because they will provide a valuable tool in providing each individual patient's response to therapy and permit a much more in-depth clinically relevant analysis of ovarian cancer treatment responses that is currently possible. We want to thank the DaCCoTA grant for this Ready to Go award, and also National Cancer Institute for providing funding to support some of the additional studies. You have in here the contact information in the bottom, so if you have questions, please don't hesitate to contact us.